Hello, and welcome to the Clinical Liver Disease video learning series. Clinical Liver Disease is the official digital learning publication of the ASLD. I'm Mzamo Mbelle, a clinical fellow at King's College Hospital, and I'm the co-author of the chapter HBV Eradication from the Host, Current Understanding and Challenges. Hepatitis B infection propagates predominantly within hepatocytes, and its genome exists in two forms. Firstly, there is a circular mini chromosome termed covalently closed circular or triple C DNA, which is a template for viral replication and expresses all the viral proteins. The second, a double-stranded DNA, which integrates into the host genome, typically expresses only HBV surface antigen and not the core proteins. Understanding the replication cycle, as well as the host response, has led to the development of various treatments that, amongst other things, improves the triple C DNA destruction, or at least epigenetically modifies its transcription, thus offering prospects for functional and even complete or sterilizing cure. The key points that will be discussed in this chapter are the HBV life cycle, as well as mechanisms of viral persistence in chronic infection. The HBV life cycle begins with binding of the virion to hepatocytes. This is done with an interaction with the virus and the sodium taurocholate co-transporting polypeptide on the basolateral surface of hepatocytes. Following endocytosis, the encapsulated virus passes into the nucleus, where the HBV nucleocapsids detach and release the relaxed circular DNA. This is then repaired by host mechanisms to form triple C DNA, which is subsequently transcribed into pregenomic RNA, as well as mRNAs, which are eventually translated into the viral proteins. These proteins are then packaged in the into nucleocapsids within the cytoplasm, and a pool of triple C DNA is maintained as a mini chromosome within the nucleus and is regulated by host factors as well as HBX. At the same time, early in the course of chronic HBV infection, a linear form of the hepatitis B genome randomly integrates into sites of the host chromosome at sites of DNA breaks, and this process is known as non-homogeneous end joining. Importantly, the hepatitis B core antigen as well as pregenomic RNA are produced by DNA transcripts from the core and pre-core promoter regions and are upstream or adjacent to the coding region. Hence, subgenomic transcripts resulting from these integrated HBV DNAs only produce HBsAg and possibly HBX, and thus result in non-DNA containing subviral particles. So as you can see, the HBV SAG can be derived from either episomal triple C DNA or indeed the integrated viral genome. And traditional assays are currently unable to differentiate from the two sources. The HBsAg is comprised of three proteins, namely small, medium, and large, and they all share the same C terminal, which is a target of the current serological assays. Their novel assays may better differentiate or characterize patients with particularly E antigen negative chronic hepatitis B, but these are not yet to prime time. And furthermore, long-read RNA sequencing may be used to differentiate triple C DNA from the integrated transcripts, but this technology requires extraction from a liver biopsy specimen. There are also newer novel biomarkers, such as core-related antigen, which is made up of transcripts that can only be derived upstream of HBV DNA. This can therefore only originate from triple C DNA, and this may better differentiate your chronic E antigen negative hepatitis B patients from those who have higher or lower triple C DNA transcription, and therefore those who might be at a higher risk of progressive disease, relapse, or even hepatocellular carcinoma. Integrated HBV DNA, as well as stable CCC DNA, provide a persistent source of HBsAg. And it is the HBsAg loss, as well as an undetectable HBV DNA, which is sustained after the stopping of treatment, that defines functional cure. And strategies to eliminate both the CCC DNA as well as the integrated forms are likely for cure. Neither are greatly impacted by nucleoside analog treatment. It would therefore be important to correlate the residual transcription from CCC DNA as well as the versus the HBsAg from integrated genomes as we define appropriate functional cure strategies. On behalf of the CLD team, I hope you found this review of the HBV life cycle useful. And for more information about this article, as well as other articles within the series, please visit www.cldlearning.com. Thank you for watching.